Well, hello everyone. This is Dr. Mike Show of Physical Therapies. Hey, today we've got a special guest. Her name is Miss Twana Miller. She's a licensed social worker from a positive living group. We'll be back in a few seconds, okay? Well, hello. We are back coming to you live here in Martin, Tennessee. I'm here in Martin, Tennessee. I'm at home, but we got a special guest for today. Her name is Miss Twana Miller. She is the executive director of the Positive Living Group. And without further ado, let's go ahead and bring in Miss Twana Miller. Miss Twana, how are you doing there?
I'm good.
Well, could you please tell us again who you are, what you do, and everything?
Okay, I'm with the Positive Living Group. I'm the executive clinical director. And what we do here at the Positive Living Group, we do individual, group, and family counseling.
Oh, wow. So you mentioned individual groups. So what is the main discipline that you guys use or do there at the Positive Living Group by the word
And that
itself,
is
right?
therapy. That is just individual therapy. That's going to be our main thing that we do here. We specialize in trauma, but we also treat depression, anxiety, like I said, trauma, PTSD. Anything that's dealing with your mental health.
Hmm. Wow. So well, let's go back to you first. So what made you work for Positive Living Group?
We founded Positive Living Group, and I would say 2018. Me and my business partner Ray Watt, we founded it. We saw there was a need in the Jackson community area, really uh, West Tennessee, that we needed a facility that focused more on trauma, focused more on children, and that we could bring evidence based practice, very forward type practices to this area. So we saw
Hmm.
the need. We opened up in March of 2019, and it's been 7 years later.
Wow, that's amazing. 2019, before COVID, right?
Right before COVID. Yeah, right before it, and then COVID
Uh-huh.
happened. Yeah.
Well, could you please tell me what are the most common conditions that you guys treat and accept there? I know you mentioned depression. What else are the most common conditions that you guys see?
I, I think, and I like that you're saying common, because I think a lot of people think, when they think mental health, they think, this person has to be crazy, they're hearing voices, they're seeing things, or they're out of control. But, we as everyday people, we deal with depression. There's not many humans that haven't had a bout, or, continue to battle depression, anxiety, and like I said, and our specialty is PTSD, and then anything pertaining to children.
Mm, wow. So depression, anxiety, and everything like that. So with regards to accepting these patients, I hear some feedback. With regards to accepting this patient, how do they get referrals, or can they just walk in directly to your facility?
They can walk in directly to our facility now. There's a chance you could be seen that day, but if you came into it directly, you're definitely going to have an appointment within the next 24 to 48 hours.
Do they need some doctor's order too, or referral?
No, you
No
do
need.
not need a referral in order to get mental health counseling and treatment. You do not need a referral. Some people just need somebody to talk to. Maybe you're going through a lot of stress. Maybe you're overwhelmed. You could be overwhelmed at work. You could be overwhelmed in your family life. It's just dealing with life. And so you want that person that is confidential. They're outside your circle. They can be, non-judgmental. They can validate your perspective and your perception of everything, and help you to navigate through that.
That's so true. I like what you said about confidential and sometimes just outside of your circle.
Oh,
It's
outside of
very,
your
yeah.
circle, absolutely. We're not in your family. We're not in your friend group. We don't work with you. So, we can be objective. We can challenge you on certain things, but we also, are here to validate you and help you work through it, so that you can become a better version of you.
Mm, that's what we wanted to have. Even us, physical therapy. It's not just restorative. There's different types of therapy that we provide in J Rehab. We do restoration therapy, wherein we restore them. For example, I had a hip replacement, knee replacement. But there's also what we call maintenance therapy, where we maintain the patient to prevent them from declining. There's also the next level, wherein we call the next level therapy, wherein we're pushing them to the next level. So different stages of life, different stages of injuries. We do that in JRAB. And that's the same thing with positive living group two or your mental health counseling. You have different levels of progression. You're depressed. If you reach a certain level and you want to be next level, that's where they come in. Ms. Twana, where
Absolutely.
the next my next question for you is that do how about payer sources? Do you accept major
We accept
insurances? Is
all
this
major
like cash
insurances.
pay? Hmm.
Yes, we do cash pay, but we also accept all major insurances. We're credentialed with all the major insurance companies, so yeah, we accept those insurances.
So what are the major insurances that you accept?
Blue Cross Blue Shield, Aetna, Humana, United Healthcare, TRICARE, Medicare, Medicaid. Yeah, all the major insurances.
That's good. That's good. Well,
Cigna.
yeah, we same as too. We also accept most of it, well, but mainly we see Medicare beneficiaries because we're just geriatrics. With
But
regards to, mhm, go
with
ahead.
geriatric patients, a lot of people don't realize, when you get older, retirement alone is a big transition. And a lot of times people just don't, we all work to say, hey, we're going to retire one day, we're going to stop. But, it's such a big life change. And sometimes people can retire not just the normal progression, getting to a certain age, and now I've made, I've got a certain amount of money invested, and now I'm going to retire. It could be due to an illness, it could be due to a physical injury or the progression of some kind of health problem that leads more to disability. And anytime we're dealing with a physical health problem, it typically, and we're not functioning the way we used to function, that's going to bring about some kind of depression, or it's going to bring about some feelings of, feeling overwhelmed or anxiety about, how is this going to be for me now that I'm having to deal with this type of injury or recover. So that's where we come in at. And a lot of times, elderly people, they battle a lot of loneliness. And so that's where it comes in for us to kind of be that person, that calls in weekly, you talk to, you kind of handle things, you deal with things, you look over your lifespan, and just having somebody in your corner to talk to. So it's very important, I'm glad that we're doing something, with the more so geriatric population, because I feel like that they sometimes get overlooked when it comes to counseling. We kind of think that if someone is older, they're okay, but they're not either.
No, they're
No,
not.
they're not.
There's a reason why they have
Why?
limitation in their functional mobility because of that sickness. And then the limity, the functional limitation is not just because of their function. There's an underlying illness like some sort of depression, and that leads to more complicated issues. Yeah, so it's very important that you take care of your mental health first, right? So in therapy, we work on the movement, the strengthening of the muscles. Well, guess what? When you go talk to your doctor, your physician, they're talking about strengthening your heart, improving your kidney function, improving your motility. If you are a GI doctor, well, guess what? You also have to work on your mental, your brain health. That's why mental health and mental awareness is very important, and someone to talk to. In for those people who are watching live, comment live, watching in the replay, comment replay. I want to share this. When we are working out, I don't look like I work out, Miss Twana, but I do a little bit. When we work out, what do? We ask the patient to breathe and count out loud because we want to release that pressure, the psychological pressure. Well, guess what? Same thing with when you're passing gas. If you're not passing gas, guess what? You develop some gastric pain, some stomach pain, and because you're not releasing that pressure. Well, guess what? Same thing with your psychological pressure. If you are not releasing it, talking it, and telling it to someone and sharing it, you're keeping everything, and then out of nowhere, you're just burst out. and that pressure inside your heart, we call it blood pressure. If the pressure is high, you develop hypertension. If the pressure in your kidneys is high, you get kidney failure, right? Well, guess what? Same thing with your psychological pressure. If your pressure, your psych pressure, it's not released, psychologically and mentally and physically, guess what? You'll have some mental breakdowns. And let's face it, not all are strong. I'm an immigrant. I mean, I don't speak the English language well. It's so hard to find and release your stress. For me, my stress reliever is playing games, video games. But some people, they just want to talk, and this is where positive living comes in. They're here to talk to you in a confidential way, of course, following the HIPAA law, and of course, they give you the right recommendation. So, with that being said, Ms. Twana, what kind of recommendation do you normally do for people who are, some anxiety, depression, loneliness? What kind of intervention do you guys do there?
Well, one of the first thing we want to do is come in and give you an intake, and then we want to do some assessments to see, measure where that anxiety really is, and then teach you ways to kind of cope, manage, and give you tools to kind of work through that anxiety. Like you said, having anxiety all the time is just not good for your mental health, but it's not good for your physical health. It runs up your blood pressure, and like you said, if your blood pressure is high, your kidney pressure's high and everything else that goes along with it. We treat people that are in their 30s and they're already on blood pressure medicine because what? They've got so much anxiety and or they're battling, PTSD symptoms because they've already experienced trauma.
All right, perfect. Well, again, thank you very much, Ms. Twana. Some people and get some feedback there. But where can they find you? Your telephone number, your website, and address, and everything.
Okay. Our website is www.positiveliving.group.com. We're located at 39 Maryguard Drive in Jackson, Tennessee, but we do provide telehealth. You don't have to you don't have to come physically in person. We provide telehealth services. Our telephone number is 731-736-4400. You can either call us or you can go online to our website and you can make a referral. You can reach out to us on Facebook. We're on Facebook, we're on LinkedIn, we're on Instagram and TikTok.
All right. Well, again, thank you very much, Miss Twana. I appreciate you. But before I let you go, ladies and gentlemen, always remember the word fast, FAST, letter F. Find people that will bring out the best in you because you are the average of 5 people you hang out with. Today, I hang out with Miss Twana. I feel like I want to get a consultation now, right? Next letter is letter A, take action. All this stuff that we're doing is not going to do me good. It's not even going to do Miss Twana good if you don't take action. Take action. Go to their website, Positive Living Group, or just call them. Hey, what can you do for me? And how can you help me? Stuff like that. Just take action. It doesn't have to be perfect, right? Next letter is letter S, and share, subscribe. The more shares, the better. They have a Facebook page. They have a website. Share it to your family member. Hey, mom, do you think you could benefit from this? There's nothing wrong talking to. I have my own mental health practitioner friends too, and then I call them. I use Teledoc and telehealth. So talk to them, right? Talk to them. And last but not least, letter T is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. And that's what Miss Twana is doing. She's teaching you how to adapt and adjust in this ever-ending field of high pressure area in our field. Again, thank you very much, ladies and gentlemen. We appreciate you. Be awesome, be great, be excellent. We'll see you in the next episode of our Jerry Hab Show. Thank you, Ms. Twana. Bye-bye.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces